Hi, Caroline.
Hi there. How are you?
I was first diagnosed with restless leg syndrome when I was about 30. And when I went to my primary care doctor at that time, he just looked at me and said, I sure hope you don't have restless leg syndrome because there's no cure for that. And now, 40 years later, unfortunately, there still is no cure.
Any numbness, tingling?
The worst thing about it is that it really prevents you from getting decent sleep.
Close your eyes for a second.
It creates an uncontrollable urge to move your legs. And so you have to get up and walk. And as the disease progresses, you also get it in your arms. And so you're walking and shaking your arms and trying to find some relief while you're trying to get to sleep. It's very difficult to sit in a movie or at the theater. It's very hard to go on a long airplane flight. And any time that you have to be still and can't find relief by movement, it's just excruciating.
Imagine not being able to sit still, not being able to tolerate sitting still for more than a couple of minutes. Restless leg syndrome has a name that makes some people think it's a silly condition, but when it's severe, it really lowers a person's quality of life, and people who have restless leg syndrome really need help. It's defined by 4 basic symptoms: the restlessness itself, the worsening with rest, the improvement with walking, and the most interesting aspect is that restless leg syndrome generally only affects the person in the evening and early part of the night. It's not a 24-hour condition. The Scripps Clinic Viterbi Family Sleep Center was just certified as a quality care center by the National Restless Leg Syndrome Foundation. We're actually the only quality care center in Southern California and only the second in the West. We have an 8-bed polysomnography lab. We have 5 physicians from various specialties, and we have 3 physicians who have undertaken the necessary training and have the experience to be considered experts in restless leg syndrome. Oh, well, this is the timing of them.
Yeah. Dr. Poceta is just tireless in terms of trying to help his patients find relief. I started a support group in San Diego. We're here to help them, that we have great doctors, and we can provide some support for them.